Well, hello again, everybody. Welcome into another installment of the Keep Boone Healthy Facebook channel. I am David Jackson, President and CEO of the Boone Area Chamber of Commerce, coming to you just offset from our earlier Vision Northwest North Carolina event that we held here today at the Skyline Skybest Customer Center. We are joined today by Director of Pharmacy with Appalachian Regional Healthcare System, Sean Burroughs, and of course, the Director of Public Health for AppHealthCare, Jennifer Greene, two friends of the program. As we promised, we would check in with these folks frequently about where we are in the community vaccine deployment. And certainly, Jen, we just came off of a great partnership event between these two organizations to have our first mass vaccination clinic here in Watauga County happen just this past weekend. What can you share with us about the success of that event and the planning that went into getting almost 1,200 vaccines in arms here locally this weekend?
Well, I just can't say enough about the partnerships that we had. The team at Appalachian Regional Healthcare System really helping plan the logistics, Watauga Emergency Management, the use of Watauga County schools and some of their staff coming to help the event. We had the town of Boone. We had so many people who jumped in and a ton of volunteers that really made a big difference. And I think that it went as smoothly as possible for some really quick turnaround planning. And it's because everyone pitched in to make it a success.
Sean, you were the pharmacist behind the scenes working the magic to get as many doses of this vaccine out. Can you talk a little bit about what that process is like from your end of it, from the mad scientist end of it, so to speak, and how you were able to deploy this vaccine in a way that could get to so many people on Saturday?
Yeah, and as many folks know already, the Pfizer vaccine is a little bit more challenging when it comes to cold chain storage and its stability. We had a fantastic assembly line of pharmacy personnel and volunteers in the back, and it was everything we could do just to keep up with getting enough vaccine out to the tables so that they could vaccinate. The Pfizer vaccine comes in basically bulk of 975 doses, or 195 vials, and each vial contains at least 5 doses. Some of them contain more, some of them contain 6 doses. So the planning part of that, as far as the number of appointments that we were able to make, was more of a prediction. You're never really sure how many doses you're going to get out of the Pfizer vial, so we were able to get some extra doses at the end of it. Again, and the most important thing is that we did not waste any of those doses. Every dose that we were able to draw up out of the vials, we were able to get in someone's arm. So it was a full 6-7 hours of, as you said, mad scientist, complete assembly line work back there. But I'll echo Jen's sentiment that the energy that I felt from the volunteers, that we had so many volunteers, and the clinic was supposed to end at 2, but we had more doses and people sticking around. Nobody really wanted to go home. It was very inspiring. So I was just so blessed to be a part of it.
What was also inspiring was the fact that you were putting those things together right across from the table of donuts from local Lion, and you didn't break the assembly line. You were actually able to get the job done out there. So we do.
Not that you saw.
Well, that's right. That's right. So part of this exercise was, as you mentioned, to get as many doses out as you possibly could with the supply you had. But Jen, I know there's a business transaction that comes from that as well, in being able to use the supply that's been allocated to the county before more supply can come. Can you talk a little bit about what that fundamentally looks like, and how the health department, Appalachian Regional Healthcare, and other partners have worked to make sure that you have the maximum throughput you possibly can to be able to unlock the next phase of this, so to speak, in terms of deployment for Watauga County?
Well, I think the big thing to know is that we're in constant communication with each other to know how things are going. We do, certainly believe in partnerships. We have already talked about our partnership with Boone Drugs, which is really an extension of us. We aren't able to broadly see vaccines in a lot of different providers at this point. There's just not enough supply. But right now, we're trying to establish these partnerships so that as the vaccine supplies increase, we can work together, whether it be in a big community clinics like we did on Saturday, or in other ways, like satellite clinics that can be going at the same time that we have a clinic going, at the health department. That is really our strategy, and really with the goal of emptying out the tank every week. So every time we get first doses, we empty it all out. And I think what's important for the community to know, the other part of that is not just putting shots in arms, it's the data entry behind it that is also a very heavy lift for every provider who's having to make sure they're getting shots in arms, but also getting everything entered into this data system.
So we know that both of you are deploying every means necessary to get shots out to people through the vaccine process, whether it's a mass event like we saw Saturday, or in the case of Appalachian Regional Healthcare System, and certainly the health department as well, taking individual appointments at your facilities to help facilitate that process. I think the big question on everybody's mind is, what comes next, and what is it, or what, if anything, can you allow to where we are in the process currently, and what might be the next opportunity for either a mass event or just simply continuing on the process of trying to get as many people scheduled into appointments in the particular group as we particularly can right now?
Well, I can start, and Sean can chime in, but I think our goal is really to try to project out and see what is our capacity, how can we do this if we work together, and if we really maximize our capacities individually too. So we're going to be doing some planning. We know February 6th is going to be another big clinic at Watauga High School. Everyone who came to see us this past Saturday will come and see us again, or is invited to come and see us again to get their second dose. So we're going to be planning to scale up, because as we move forward, we're going to be trying to get all the first doses out and increase that allocation that comes to us in the community, but also make sure that every single person that needs a second dose gets it on time. And that is really important for the public to know. We get those shipped separately, so we aren't holding back any doses that are intended for first people who haven't gotten vaccinated yet. We know we have a separate supply for people getting a second dose. And Sean may want to add to that.
No, I think you said it perfectly. It's a lot of projection, trying to figure out what we need to try to handle through the clinics that we currently have, and how we can have more clinics and more hours and have more doses and get those out as well. So it's a constant. Jen and I are in constant discussion with each other to try and figure out how we're going to do that with our individual entities, but collaboratively as well. And I think as we continue to go through these phases, we will need to continue to collaborate with each other, obviously, but also include other entities that, as maybe they relax some of the restrictions as far as who can administer the doses and who can store them potentially. I think we'll need to continue to work with the other members of our community to get the vaccine out as quickly as possible.
One of the things that we discussed last week when we put together our super panel, if you will, and discussed vaccine deployment and all of its different aspects here in Watauga County, we even threw the disclaimer out there that said, make sure you know the date that you're watching this, and make sure that you keep up with any changes that occurred. We recorded that on a Tuesday, and sure enough, on Thursday, the state changed pretty much all the group rules around how the vaccine deployment works through individual stages and who is available for it at what points in time. Jen, can you share any of the nuanced changes to that and what that means for us right now as to where we are and where we're hoping to go here in Watauga County in terms of progressing to get more people vaccinated?
Yeah, so we are quickly adapting, and I think last week we both tried to shift our goals as the state changed our new guidelines. So really what that does is healthcare workers, there's a broader definition of who fits in as a direct patient healthcare worker. People giving direct patient care now fit into phase 1, and long-term care residents and staff, we knew were already in that group, and we believe we've worked through the group, except for perhaps some healthcare workers that maybe weren't originally in the first definition that has now been clarified. And then the next group has been expanded. So rather than 75 and older, it's now older adults who are 65 and older, regardless of conditions. And so that's what our goal is right now. That's where we're focused, is trying to get through those two groups with the majority of people being 65 and older, people in our population that we know are at higher risk. So that's going to be important because that's how we get through this next phase, and then we'll move on to the next group, which is essential workers.
And I know that there was some confusion even Friday and Saturday about that 10-year group, if you will, of 65 to 75 that may not have understood that the rules had changed and wondered how they get access to the opportunity to vaccinate. Can you run through each of you individually kind of how your organizations are populating lists right now, and how people can maybe work to make sure that their information is submitted to the right folks, so when their group comes up, they're flagged and they're contacted, as many people did this past weekend?
Sure. Well, I can start and just say, if you complete the vaccine interest form on our website, apphealthcare.com, or if you call us at our call center, it's 828-795-1970. We can help enter your information over that website form. It will ask you your age. And so what we're doing is we're using that information to sort our list. So when the state changed the guidelines, we were able to quickly use that information. And I'm sure Sean might want to comment on their data process, but data is driving us, I think.
Yeah, for us, basically when we drop from 75 to 65, and there's no perfect process. There's always wrinkles in the fabric, but we've tried to notify everybody that was within that has seen an ARHS prescriber that was 65 and older, that they are now eligible to receive the vaccine and can schedule their appointment. So I'm sure that some folks maybe didn't have a phone number that was accessible through the text, or maybe not an email, but our clinics continue to be pretty hefty, pretty full. And so I think the word got out to a lot of folks that 65 and older now can be seen as well. So between the health department and ARHS, I think that we really shifted gears quickly late last week, and are doing as much as possible to hit the folks that are 65 and older.
And nothing like a curveball in the bottom of the ninth with 2 outs, right? But I agree, you all handled it very well. Anything else that either one of you would like to share? I know that the volunteer interest form for those that want to participate in any of the AppHealthCare efforts, not only in Watauga County, but Ashe and Allegheny as well, that information is being parsed out on the COVID-19 vaccination section of the AppHealthCare website. But any other additional information that you feel like might be helpful to share with folks about this process at this point from either of you?
I think stay tuned, and we will pivot again as we go throughout this journey and work together. And I think be patient. We are trying to work through our lists of patients as quickly as possible, and it's we still don't have a whole lot of vaccine coming our way, and I'm grateful for the partnership we have with ARHS and our other community partners. But yeah, be patient. We're trying to scale up and be ready when we start getting more supplies.
Yeah, I would echo Jen's comments, just so that folks understand. When you see 1,000 patients and get them through in a 6-7 hour span, that's fantastic. But there's 80 hours of back end data work that needs to be entered. So I know that that data entry help is definitely important for those that are interested in that part of it, and that's what CVMS, that's what the state and CDC are looking at. Even though we've vaccinated folks, it might not be in the system yet, so it doesn't look like we've vaccinated them. So that's a very important piece that kind of goes under the radar. That any help with that is certainly appreciated, I'm sure, from our perspective and the health department. But again, we're not sitting on doses. We're getting them out as quickly as we can. And I'm hoping that as they, again, I said this earlier, but I'm hoping they relax some of the regulations a little bit, so that will help us involve Boone Drug, help us involve other pharmacies, other entities that would be able to allow us to vaccinate a little bit quicker as we increase our allocations.
Well, and I think you hit on such the key phrase there too, is increase the allocations. You can't vaccinate what you don't have, and certainly making sure that the county has the stockpile to be able to get vaccinations out to the health department, to the hospital system, and to anybody else that does get into this mix at some point in time will hopefully grow to the point where we can see more of that deployed on a weekly basis. We certainly appreciate the two of you taking some time out of your day and being willing to share kind of where we are. I know we're going to check in again, but again, on behalf of everybody that was involved with the event Saturday, hats off to you and your staffs and all of the healthcare workers that came together to make that event possible as well. I know there were school nurses and others that came off their shifts to make sure that they could staff things up appropriately. And on behalf of the entire community, we certainly appreciate that effort and look forward to the next one for sure.
Thanks,
Thank you,
David.
David. I appreciate it.